Welcome to another backstage talk of Unity Flow Summit. My name is Elizabeth Mehr. I am a soul therapist specialized in regression therapy and Akashic records. And today we are going to have this chat with Anne-Marie Pereira. She is a clinical and RTT hypnotherapist, and today is her talk live at the Flow Summit. So please don't miss it. She is a wonderful woman. I'm really excited to have this conversation with her. And remember that if maybe today you didn't have the opportunity to watch her talk at Unity Flow Summit, you have 48 hours, so you can do it as well tomorrow. But I highly recommend to go in the Flow Summit and check her talk because it's amazing. And for what I understand, she's going to talk about the most important thing, that is being alive. So let's see if she's over there. Not yet. Anne-Marie, please join us. So remember that at the Flow Summit, it's an online free event, so you can watch every time that is better for you. You don't have to have a certain moment of the day. It's whenever you feel comfortable. You receive an email and from Unity, from Vlad, and he will explain you what's the energy of the day and the speakers that are in the Flow Summit. And from there, what we'll do is that you can choose among a quantity of speakers that are already there. And you can choose what talk you want to listen that day, or to watch that day, or the following day. There are a lot of speakers, and I know that it's a lot of information. I truly understand because I'm going through that same period as well. But try to feel which one resonates with you every day. And you will see that in the email, it is really detailed what's the energy that is introduced in that day. And each speaker talks about it from their own perspective. So I really, really, really invite you to register. If you haven't registered yet, please drop me a message and I will share with you the free registration link. And you can listen to Anne-Marie's talk that is today, and mine, of course, that is on Monday. So remember that if Monday is not a great day, you will also have access to it until Tuesday. And my conversation will be about soul fragmentation and how to integrate and recover those pieces of our soul that left, and that they want to be seen, they want to be healed, and they want to come back to us. So let's see if Anne-Marie is there. Not yet. Okay, let me see if I can invite her. Okay, just a moment. I'm not quite... Bear with me a moment. Anne-Marie, can you hear me? Are you there? Thank you. How are you?
Hi, Elizabeth. I'm good, thank you. Thank you very much for having me here and for us to have the opportunity to have this conversation today.
No, I'm very honored and super happy that you accepted this invitation, because we do it among the speakers to get to know each other, to share a little bit what we can't share because of time at the Flow Summit, at Unity Flow Summit. And congratulations, you're talking today live.
Today, yes.
Amazing, amazing. So how would I did a small introduction, but if you would want to introduce yourself or tell us a little bit about how was your path to become a clinical and RTG hypnotherapist and, specialized in the area that you are specialized in fertility and in, being alive. I read that in your website and I thought, this is amazing. Remembering that, right?
Thank you. Um, Basically, I feel like most of us, right, this work finds us more than we actually find it, right? So I lived off all of my life thinking I was making the decisions myself, right? What I studied, the companies I worked with, and everything, because I've not always been in this area. I've not always been a therapist.
Right.
I've been in this area for 6 years now, so I've really thought all of those decisions were from me. Up until life broke me open back in 2017. And in that moment, when I started to question absolutely everything, and I understood more about the subconscious and about the fact that most of the decisions we make are not even ours, I started to understand that all of those decisions that had taken me up until that moment were made for me to get more love, to be accepted, to belong in my family. And I really started to see life in a different way. So at the same time, I was questioning myself about what was happening and I was looking for answers. I got to know about hypnotherapy. And actually, that was my husband that found it for me. And today, I rarely, I think we talked about that the other day. I don't believe in coincidences anymore. So, it found me, it helped me, and it opened a new door. I had never thought I could become a therapist one day. It's absolutely nothing I ever thought I would be doing. And for some reason, this happened. And I started to work with women because for some reason I knew I had some work to do with women. And as I was starting my practice, more and more women going through fertility challenges and especially unexplained infertility started to come to me. And I understood that this was the moment of a woman's life when we can give so much help. And that's why basically I started to work with women going through unexplained infertility mainly.
That's amazing. That's amazing. And I liked it when we talked that you told me it's not only about fertility. I mean, you're specialized there, but also in the creativity and process and feeling alive, being alive. And when I heard you, I said, I have to bring this up to our chat. So
I
tell me
think
a little bit more about that.
Yes, when we look about a woman's body, we understand that in terms of energetics, the same energy that will create a baby is the same energy that would create anything. So it can be art, it can be dancing, it can be a project, it can be anything that you want to create that's new. The energy all comes from the womb. So I use it a lot also with the clients that I work with in terms of fertility. We uh, do everything to bring this creativity energy inside of their life. Why? Because when we're on a fertility path, there's, I don't like to use that word, but that's actually what's happening. There's an obsession about having a baby, which makes absolutely everything else fade away. So bringing this energy through something else, which is creativity,
Yes.
and blocks everything else. So when we look at fertility in a broader way, and which was what we talked about the other day, it's really about anything you create. Anything you create is the same energy as bringing a baby into the world.
It's amazing. And let me share with you something that I never talk in a talk or in a as a speaker. when I have a daughter, and a year after she was born, I started to look for another baby. And I was 38 years old, and my gynecologist at that moment told me that my menopause came very early, and she used something similar, like my ovules were useless. And you I can't explain you the shock that I went through, because I was in that creativity process, trying to have a bigger family of my own, and all of a sudden you receive this news, and I wasn't in the spiritual path, and I can honestly say I was super mad, super angry with God, with the universe. Like, I didn't understand why I had to go through this. And it's all a process that, in my case, I was blessed to be with a psychological therapist who supported and guided me. But then you get to know other women that has this same. It is not a disease, because the doctors, even they don't know why it happens, and they are alone, and it's so painful. So I want to really thank you, on behalf of all these women, that we went through situations like this, that are so, they depleted you. You feel less than zero, and there's this feeling of something unfair happening in your life without causing it, right? And so you being so brave to help in this deep soul of the wound, I'm honored that you accepted to have this chat, because I know how strong you have to be to accompany someone that is in any of these processes.
Thank you. Thank you for your words. I think we all came to do something, and for me, it just, when I look back, there is nothing else I could be doing right now. So
Exactly.
it just makes sense. And I feel your words, and thank you for sharing your story, because for sure some women will feel what you've been through. And I think that's also something that needs to be done a lot. I go online, I go to forums, I look at what women say, and it can be so negative, especially because the words used medically are not always the best. And there's a
No.
lot to do to help these women bring joy again in their life, which is like something I really feel I need to change something there. And I'm going to take an example following what you shared. So I work with women internationally, so not only where I live in Portugal, but also abroad. And 6 years ago, I would work with women 35 plus. So let's say 38, 40
Yes.
years old, 42 years old. Today, women before 38, 35 come to me, so 32, 33. And so we see the tendency is for this unexplained infertility diagnosis to be given earlier and earlier in age. And I have a client that a few months ago showed me her medical documents, and it was written geriatric pregnancy. So when you're 35 and you get that kind of word attached to something that's so beautiful as to become a mother, psychologically, it's very, very tough. And
Yes.
so there's a lot of work to do to help these women really understand the power they still have in themselves, and not hand all of this power to clinics and doctors and everything. So
And that's amazing. When I got pregnant of my daughter, I was 34, I lived for 2 years in Mexico, and my Mexican gynecologist, then I came back to Spain, said something similar. Your pregnancy is like, I don't know the exact wording in English, but it was a dangerous pregnancy because I was 34, and I was like, you know, he's crazy. I mean, he's crazy. I'm 34. I am in the
I'm happy
flower
you
of
thought
life.
that.
Like, not my problem if you have younger mothers, but I am not in danger. My baby is fine. I am not that old. I was before going to Mexico, I was living in Spain, and I had friends that had her first child when they were 40. And you say, in that moment, you realize that they can be amazing, absolutely the best doctors, but there is a lack of empathy. Like when I came back into Spain, and the Spanish gynecologist told me, "Oh, your ovules are useless." I was like, oh my God. And I think that this is something that, from my experience, is that is when we have this soul fragmentation, because it's so big. The news, you are into such a great shock that part of your soul leaves not to feel. But that's my conversation. We are with yours on the on
No, good.
the
I
on
think
the
we
subject.
we really need to incentivize women to have some kind of help on the side,
Yes.
because we're so lucky that we have doctors. We're so lucky of the way technology advances and helps us in reproduction. But at the same time, we need to understand how easy it becomes when you're in a vulnerable state. As you were saying, it's so easy to take in what the doctor is saying. So I was happy that you had a friend that, had an experience of having a baby at 40, but somebody that wouldn't have this kind of experience and would let in everything that the doctor is saying, even if the doctor doesn't mean, doesn't
Yeah,
mean
but
to have a bad effect on that person. If she lets in everything that's said, then this will impact everything, her body, her mind, the way she thinks about herself.
her
And I
pregnancy.
exactly, the pregnancy, if it happens. And what happens as well is I've had the opportunity to work with women later in age, so already menopausal, and they came to me because they had all kind of physical ailments. And working with them, I understood that there had been some kind of fertility issue earlier in age that hadn't been dealt with, that had been, put inside of the drawer. And it's, along the journey started to create other kinds of physical impact, because the psychological hadn't been looked at. It didn't have a space, okay, I need to forget about it, but the body never forgets, right? So it's important that if you're on a fertility journey, or going through Unexplained Infertility, that you look for somebody that can hold your hand psychologically and help you understand, why you're going through this challenge, whatever therapist you decide to go for, but somebody that will help you look at your experience in a different way.
Yes, absolutely. Absolutely. I think that is super healing, and well, I am 50, so now most of my friends are in that menopause process, and they're telling me, how did you go through it? And I was like, I didn't have any choice. And for me, that, again, thanks God, we have all these medicines and medications and technology and great, great doctors. But I decided it consciously, and I really feel I was guided to not take any medication. Just if this is the process, my mom didn't have any medications, my grandmother didn't have any medications, so I will be strong and go through it suffering. And actually it wasn't that bad. It was great, actually. And it was all an experience. Now I explain it with a smile. In that moment, of course, yes, it's hard, and you don't sleep, and you get all nervous, and all of a sudden, what happened to me was that I lost a lot of weight, and then I gained a lot of weight. And what the learning from that experience is to have compassion to myself. And, if we learn that since we are a child, we will have a totally different humanity.
Yes. And coming to what you say, that's what I've tried to give inside of the talk I'm giving as part of the Flow Summit. So
Let's
coming
be a
back to
little bit
my
spoiler. Explain us your
yes.
talk that is today, so people get more anxious and goes and watching.
Yeah, it's really about when the body starts to shout and you don't understand why, why it's hurting, why things are not going the way you want to. You start not understanding why your mind is thinking a certain way, why your body is hurting a certain way. We understand that we're so hardwired to be perfect, to be perfect, to be independent, to be, I'd say, like men, basically, right? That our body won't manage to function like this for many, many years. It will, for maybe 2-3 years, we'll be able to be on the push, push, push side, on the do side, and we can manage to be very successful like that. But there is one moment in time when the body will say stop. And so the talk is really about that, about the broader side of fertility, which is health. If a woman has a fertility issue, usually we can look at the overall health. How's the mental health? How are the thoughts? How's the body? How are the emotions? And we will find fertility never comes along. That's my experience. When somebody comes to me for unexplained infertility, we can look at many other things in life, many other ways the body has been speaking, has been shouting, until this fertility issue that's usually very deep and very hurtful, as we were saying, right, as you shared, until it comes to the surface. And this hurts so much that usually women will open a door to understand, okay, something's going on, because the body is touching such a deep wound.
Right. And would you, I don't know if it's possible, but share some tips so that when someone listens to this conversation can relate, like, oh, okay, because me, that I know nothing or only what I shared. I remember having friends that had really bad cramps, and wouldn't even go to class because so maybe this has nothing to do, or maybe you say yes, the first red flags to start bringing consciousness, which one could be, Anne-Marie?
So I'm going to say, with regards to my experience, and as I know also the people that will be watching it, our talk from your side and from my side are quite open-minded. So
Yes,
let's be open-minded as well.
exactly.
Most of my clients, most of the women I speak with, there's some kind of mother issue, right? So usually when I want to become a mother, then I have to look at my mother. Am I accepting my mother how she is? Am I afraid of becoming like my mother? Am I afraid to reproduce something that I've been through and I don't want? This sometimes happens. Most of my clients, they go back to early childhood. They go back to their own birth, or they go back to even the time they were in the womb.
Right.
And a big percentage of my clients are actually surprise babies, right? So babies that the parents didn't expect. That's my experience. Doesn't mean, you know, it's the experience of everyone, but that's the experience I have seen. So let's say you were talking about crumbs, for example. When this happens, and I remember myself, I had huge cramps when I was a teenager, and for some reason it disappeared later, and I have never, you know, felt them anymore. And I understood that my mother had very, very difficult time every month. And I understood, oh, is it mine or is it hers?
Yes.
And I want to be closer to her, and to be closer to her and to be accepted by her. Do I have to feel the same thing? And was she doing the same thing from her own mother? So there's also a lineage work sometimes that need to be done. And today I look also at this systemic part of fertility, because I've seen that happen quite often. So I looked into that to bring this into my work. But basically what I would say is to start with, look at your relationship with your mother. And it doesn't mean you have to call her every day. It doesn't mean you have to be best friends. It's really about how do you feel about that relationship, whether she's still here, whether she's not here anymore, but how do you feel about it? Is it something that you feel is open in your body? Is it something that you feel is like this, and it's a sensation that closes you off? Maybe that's a first step. Maybe, you know, like
You
a
feel the
first easy
mother
step.
of your mother. That is also quite common.
Yes. And maybe just writing a letter to your mother or a letter to your feminine lineage can be a first easy step. And there's nothing special that you need to write. It's just whatever comes in that moment, and just bring some peace to that process as a start.
That's amazing. I never thought about that. You know, and you it's really blow-minding, you know, because usually when you I don't know if you heard about biodecodification. What they explain you is that the energy of your mother is what will bring to your life creativity, money. So usually for people that have problem with money in this lifetime can have a bad relationship with the mother. But I never heard that, you know, you can bond through pain with your whole female lineage. That is amazing.
It's like if you think about it, and it's very similar. That's funny when you speak about bio decodification. It's very similar to the systemic part of things. We look at, you know, what has happened to them and how we feel that, okay, if I want to be part of that, you know, the feminine of my family, then I have to reproduce. When we have to understand that they've been through such difficult times, that if I want to honor them, then I need to do different. I have the right to do different. They've fought,
Yes.
so we could do different. But we need to look at it differently, right? If we are on the unconscious, just doing, you know, without thinking, on the automatic pilot, then most of the time we will reproduce. It's like, let's take another example. When we grow up, most of us, we're like, okay, I'm never going to be like my mother, right? I'm going to be completely different. I'll treat my kids, you know, they can do whatever they want. I'll never be the same, right?
I'm in that list.
And it happens to most of us, right? And the day you become a mother, you don't know what it is to become a mother, right? It's completely new. So what your subconscious will do, it will look for the, you know, the program that
reference.
says, how is it to be a mother? And you knew your mother the day she became your mother, right? So that's the first example that we have.
Yes.
And then we start saying, you know, to our friends, right? You know, I had said I'd never be like my mother, and like suddenly I just look like her, right? and it's like that. If we just don't stop and think, then
we
we will either reproduce, or we will be like completely different on the other side, right? So it's
right.
usually what happens.
Yes.
But it's really important that we look at it to really understand, am I doing something that I've learned, I've seen, you know, as a kid, that was the example that I had, or am I being the person I want to be? And it's not easy, right? Because the triggers come back all of the time. So we need to be, you know, we need to
Open
observe all the
eyes.
time
Yes.
what's happening, right? Because we all come to work on different things. So they will show up from time to time. We just have to observe them and understand, oh, that's the old trigger coming back, and just really take the decision of what we want to do different. And yeah, that's what I tend to see happening. Most of the women I speak with, there's challenges around the relationship with the mother.
Okay.
And there is usually something around the feminine lineage. Let's say there is either some kind of health issues happening, you know, generation from the generation, until somebody really looks at it and understand it, and, you know, okay, decide, I'm the last one. This is not, you know, this is not moving. Yes. One more generation. Yeah, so it's beautiful, and at the same time it's a challenge. But I feel like we're given so much information, and we see that in this summit, so many people talking about this subject. We just need to see, okay, who do I resonate with? There's so much information available for us to choose to do different, that I feel we're very, very lucky in this point in time to be able to make these different decisions, because they were not, right? They didn't have the information. They didn't have access to everything that we have today. So it's also a responsibility somehow for us to decide to do something different.
Right. No, absolutely. Thank you so much for that. It's amazing. It's amazing. And Marie, what age do women start coming to you? Is it only when they want to become pregnancy, or is it also, for example, someone that is having painful periods, or, you know, I more or less explain a little bit, you know, like you start with teenagers or just with grown-up ladies? How does it work?
So it's usually women come from 35 up until 45.
Right.
Okay, that's more or less the age of most of the women I speak with. Now, when do they come? Sometimes there are people that really want to do everything to try naturally. So they come because, you know, usually it's not the first stop to try hypnotherapy. So they usually have been on
a very long path.
Yes, on a really long path, trying a lot of different things, different therapies, and they open that door and come to me because they really want to go for something natural. Sometimes people come to me alongside IVF to have that emotional support on the side. And sometimes people come to me because they've done several rounds of IVF and they just want to put all of the fertility journey on the side and want to somehow feel something. So they want to, you know, find joy again, whatever happens, but really, you know, manage to live again and feel joy and then be doing other things than thinking about fertility all of the time. So basically that's what happens. I don't usually work with teenagers, but from time to time a client asks me to work with their daughters, and it's beautiful as well to work with younger people. I think there's a lot to do as well on that side to help them before everything happens, right?
Yes, exactly. That's amazing. Yes. So I'm really, honored to meet you and the work that you do, because I work also as a regression therapy, and it's true that sometimes when a client contacts us, it's because it's almost like I tried everything and you are my next step. Like they don't come happily to receive that healing. It's like, okay, I'm trying something else. And when you said, getting that woman to tap into life, tap into joy, that is an amazing result, because it takes not only to have a great therapist accompanying you, but is that the person has the will and
Yes.
the responsibility to say, up to here, I'm changing this. I will be honored, to be called the black sheep of the family, and let's flow.
Yeah, it's not an easy decision, as you say, right? But it's people tend to feel that the journey is taking so much out of their life, their relationship. They can't think anymore properly. They can't focus on anything else. Everything looks like it's all timed. It's all, like a to-do
Yes,
list. There's no joy in life. You ask them, what do you like? What do you want to do? And they can't even answer that question, right? So
right.
it's really like a scream from the soul, I would say, that okay, there must be more than that. So whatever happens, I at least want to function and feel life and feel something.
And you're right, because although we are in 2025, where humans evolved a lot, technology evolved a lot, everything evolved, as a society, we'll still have middle age or medieval beliefs. So, it's like you study, after you study, you have to go to university or similar to have a title that certifies that you're good at something. After that, you have to get married. After that, buy the house, have a dog, then the baby, then the sister or brother. And it's like, no, I want to do it in a different way, and it depends on the age that you have, and still today it's challenging. So as yourself, I became a full-time therapist 6 or 7 years ago. But before that, I worked in corporation, in multinational companies. And, being a woman with ideas, um, making things happen, I was the black sheep, and my father couldn't understand, poor thing, that I was not married when I was 28. He was like, "What's wrong with you?" And I was like, "Enjoying life." I am finished studying at the university. I was born in Argentina, and so in Argentina you work and you study, and I was enjoying that period of my life. And sometimes society uh, it's like they have these barriers, because if not, you make them think.
Mhm.
So you become, you become a challenge. And, so I totally understand when you say, feeling things again, breaking this medieval model of now I have to be a mom. No, if you want and if you desire, and if you never desire it, that's great too, but, follow your soul, not the family model or whatever expectation is from you that doesn't belong to you. And this is, I think it's very deep and profound as well.
Yes, it's the pressure, right? It's the
Yes.
pressure. So like you do everything right, apparently, right? The studying, the getting a big job, making money, having a house and everything. And then, okay, now I'm ready. I want to get pregnant. And it doesn't, if it doesn't happen now, it's it's supposed to be like that. So like the pressure, the self pressure that the woman will put on herself is huge for a start,
Yes,
right? Because it has to happen next month, right?
of
I'm ready
course.
now. And the thing is, this self pressure is already very, very tough. But then you have all the pressure of the outside world, right? The parents that want to become grandparents and the family. And we're in a moment now that, all the women on this path know they're going to be meeting family in a few weeks. The family that they've seen last year, that they're going to ask again the
Yes,
same questions.
Christmas
Like,
season.
it's a very tough time right now. And then society, right, as you were saying, it's supposed to be like this, it's supposed to happen now. And then this is so much pressure that to cope with that you have to find a way. And sometimes it's just to feel like, okay, I have no emotion, and you don't talk about what you're going through, and the couple gets like this, they can't speak to anyone because nobody will understand them, etc. And it brings you on a very complicated path, because psychologically it's quite a challenge in that sense. So really understanding that you have the right to decide differently, as you were saying, right, being the black sheep, but I think we need to give it another nicer word to,
I
to
like
that,
it. For me,
because
it's an
we
honor.
we are in this box as well, right? So we have to find a
Of course.
nicer term to give. But it's like you have to accept that you're different. You have to accept that you're not like other people. We have to, and you must have seen that as well, the biggest support that we're going to get is usually not from the closest people. And
Yes.
it's difficult. This is difficult, for people that, like you and I, have been through a normal path and then decided to do something completely different. There's some work to do with regards to, okay, I might not be accepted, but I'm fine, because this is what I want to talk about. This is what I want to do. This is who I want to be. I don't want to be put in masks all of the time, as
Exactly.
I've done since I was born. I want to be able to just be me and be accepted for who I am, whatever others think about. And it needs to come from a decision within. So if you have a hand to take, like a therapist working through whatever technique they have that help you with that, it's fine, and it will help, but the decision will always come from within.
Yes. Yes, absolutely, absolutely. And I think that that is really when we start to awake to spirituality and understand that life is so much more than the actual social model or family model. And the amazing things that you go through, even if they're tough, because all the process has each process has these lovely learnings, but also people that you really like, your friends, your family, that maybe they step aside. And I really encourage always that the best thing to do is to follow your inner voice, to follow your soul, to follow your spiritual team, if as I call it, with the Akashic records, because they're always right, and that information, it's within you when you can start healing.
I think, going a bit deeper to what you were saying, sometimes people will say, oh, but I can't hear that voice. So what we
Yeah.
need to say is, it's there. It's
Yes.
there. It's talking all the time. But as we're giving more importance to that critical voice, to that voice that's judging, to that voice that's more negative, and people tend to, like human beings, because we're, you know,
in
the
our
brain
nature,
has
yes.
changed only one person since, you know, prehistorical human beings, then we need to understand that we tend to be negative if we don't decide to be any other way.
Yes.
And it's just giving the opportunity to that smaller voice to speak louder and louder. So if today I decide to listen to it, like a friend invites me to go to have coffee, but I know that friend is always just complaining, and I know I'm gonna get out of that cafe like, yeah, I'm gonna feel like crap the rest of the day. Today I decide not to go, so I listen to myself. Okay, tomorrow I'll take another decision that shows
Yes.
that voice that I'm giving it importance, and slowly it will speak louder than the other voice I'm so used to. But it's just
Yes.
to make those small shifts and small decisions so that that voice, you know, speaks louder step by step. So it's here, but if you don't give it any importance, then it just speaks so lightly that you can't even hear it. And I guess this has happened to both of us as well, so maybe
Yes.
you have something to add to that.
No, of course, yes. We are raised um, to put the value, the volume of our head, our thoughts, our to-do list, our goals so loud that our inner voice, even if it's screaming, is not able to talk to us because we are so much in our mind, in our heads, you know, being analytical. And one of the things that I also did um, IIN to become a health coach, a holistic health coach. And this is the moment, thanks God, in our society today, November 15, 2025, to start paying attention to our bodies. So, for example, as well, if following your example, if I know that I'm going to meet this friend, that she's always complaining me, that she drains all my energies, that whatever advice I will give her, she will always receive the negative first. Sometimes we have even tummy aches or sore throats. You know, it's like and sometimes you say, well, yes, but you know, from the head. We've been friends for so many years. No, be true to yourself. And whenever there is an invitation, a project, something new, the first 3 second maximum where we have, you know, that reaction, it's our intuition, it's our spiritual team. And, you know, try to focus in those first 3 seconds, and then the mind will intervene and says, no, use the logic, you know, and it's re-educating ourselves.
Yeah, exactly. And
Yes.
I think the difficulty here is that from a very young age, we're so used to respect others. So let's take an example. When a kid has finished eating, he just
Yes.
wanna, you know, get out of the table and go play. But we're like, no. If you want dessert, you have to stay and listen to, you know, the conversation of the grown-ups that the kid really don't want to. He just wants to, you know, play and do something great. But no, you have to stay here. You have to respect others, and then you can have your thing. And it's like, it's just an example, but we all went through something similar, and we've had to put others, what other things, what other wants before. So it's very difficult to stop and think, okay, but am I respecting myself, going to that place, seeing that person, accepting that invitation? It's not natural to do that.
No.
So we have to force ourselves at first to really understand, okay, is it good for me or is it not good?
Right. Right. Absolutely. Absolutely. And this is the moment to change, because with all this shift of energies that we are going through in a planetary level, our veil of for amnesia is thinner. So you realize now when someone is lying, when someone doesn't want to be there. So this Christmas season will be quite challenging because
Yes.
you have to go to have, the family dinner or family lunch, or maybe, as you were saying, meet family that during the year you don't see, and maybe they judge or they make all these uncomfortable comments. And we have to start being true to ourselves, to be kind to ourselves. And when we start listening to ourselves, we start to really see the wounds that we have in our souls, and then you know start working with them in a conscious way.
Yes, it's a great first step to really do that and understand what's good for us. Ask that question more often. Is it respecting myself or not to do that? And then at least even if you decide to do it, you've asked the question and you understand that, okay, maybe after that I'll have that bellyache or I will feel like crap the rest of the day. But you do it consciously. That's
Exactly.
the thing. You
No,
decided to go
knowing
there
that
and still
the
do it.
exactly knowing that the rest of the day don't prepare to do anything, because you decide, you're responsible of deciding that, okay, even if she's super in a super hard moment, I want to see her, but it's my desire, not my obligation.
Yes, exactly. And as you were saying, we can easily, oh, it's not easily, right? But we can lie to others and feel like, pretend we're happy where we are and we are happy to be at that place and everything. But we can't do that to our body. So the body will always react. So it's easy to pretend that, we are all so good at pretending we're okay. So
Yeah,
we go somewhere, put a smile on, and feel like we're doing great, but the body knows if we're not. So it's important that we understand that as well. The body always knows, and even if we manage to pretend on the outside, we can't pretend with our own selves.
exactly. And Marie, it's almost time. I am very I don't like a lot of technology, but I'm worried that if we are not finishing right now, then I will not be able to publish our conversation, because it happened to
Perfect.
me once. After an hour, I couldn't find the reel, and I was like, oh my God, I lost it, had to call a friend. But so I want to really thank you very much for the work that you do, for that lovely soul that you are, helping women in a very um, profound wound, and accepting this chat that we have, and wishing you all the best. This afternoon I will watch your video at Universal
Amazing.
Summit. Yes, I got the email today from Vlad, and I already opened the link to say, okay, when I come back from lunch, this is what I'm going to watch. So
Amazing.
I
Thank
hope
you
you
so much.
receive all the love and messages that you deserve, and thank you. And my
Thank you, Elizabeth.
conversation will be on Monday, so if you have the chance, try to watch it.
Yes, I want to. I want to. I want to see what's about the soul fragmentation. You made me curious. So I'm going to watch it as well. Thank you
But
very much for
no,
opening this door for us to talk a bit more about fertility and to help women also on this path. Thank you very much, Elizabeth. It was lovely to get to know you and to chat
really,
with you today.
likewise. Have a lovely weekend. Thank you
Thank
very
you very
much,
much.
Marie. Thank you.
Bye
Bye bye.
bye.